Okay, if you have this operator's manual, this little booklet right here, I strongly advise you to look at it. If even just to glance over it, just to see what information it entails, because you might eventually have a question one day, and instead of having to find somebody to answer the question for you, you can look through this and answer it yourself. So some of the things that it'll tell you how to do, how to do properly, are how to fit the mask properly, how to make sure you're wearing it properly, how to make sure that it's sealed properly, and if it isn't sealed properly, it'll help you determine, it'll help you know what to look for, like if there's hair blocking the seal, or if there's clothing getting in the way. Just go ahead and glance through it and see what type of information is in there, just so you have an understanding of what it entails. So the head harness, I didn't want to waste everybody's time taking it off, because all you got to do is take it off the buckles and then put it off to the side, and it takes a little while to take apart, so I didn't want to go through that. Take the canister off. Take off the eye lens outserts. Some of your masks didn't have these when I looked at them, so you might not have them. Don't go trying to rip the eye lens off. If you have them, there'll be a rubber ring here, and that rubber ring around here, you'll be able to just grab it and pull it off. So go ahead and do that to both outserts. Next, you have the side voice emitter. You can get your mask carrier, find this little ring on there, and you can use this as a screwdriver. So go ahead and plug it in here in these holes and twist. Take that off. This has three parts. You have the retainer, the actual side voice emitter, and the gasket, little rubber gasket that's in there. Go ahead and remove the external drink tube from the drink tube retainer, but don't try to take it off the mask, because it's supposed to be there. It's attached. You don't want to remove it. But you do want to remove this outlet valve cover right here. You want to go ahead and remove that. And then you want to remove the outlet valve disc. Don't worry about being gentle with it, because I doubt you'll break it. But if you do, go ahead and talk to your NBC specialist and let him know your problem, and he'll probably be able to help you out. To the inside of the mask, the internal drink tube. Go ahead and remove that. The nose cup valve disc. There's two little discs right inside of here that look like the outlet valve disc. They're two little rubber parts, and behind them are plastic parts that are permanently attached to the mask. They look like little wagon wheels that these nose cup valve discs are sitting in. You don't want to remove those. It damages the mask, and you have to send it off to be repaired or get new ones. And then this is what the disc will look like, the actual part you want to remove. There's two of those, one on the left side, one on the right side. Then you want to remove the airflow deflector. There's two notches on both sides of this plastic piece. Remove the one notch and remove the other notch, and there's then you can go to the outside and just push it through. And there's three parts to that: the plastic airflow deflector, the rubber wagon wheel, which go ahead and take that off, but try not to rip it, and then you got this disc right here that prevents moist air from getting into your canister. This mask right here would be ready to be submerged in water and cleaned, but when you do clean it, once you dry it, go ahead and smack it against your side or smack it against your hand, and smack it really hard, because I guarantee you'll find some water in there that you thought it was completely dry, but there'll be more water. And continuously do that. Go ahead and dry up that water, smack it again, and there'll probably be more water. Go ahead and clean that so it's completely dry, so your mask doesn't mildew inside the carrier.